If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, why there is no permanent cure for type 2 diabetes in this highly advanced medical progressed world. Answer by Health Mirror. Yoga cure diabetes. Yoga has marvelous effect on diabetes. Study has shown that even a person suffering from diabetes up to 500 may be cured with yoga. Getting diabetes is not a sudden process, but in fact usually progresses over many months or years. In other words, your symptoms may not manifest until years after it was triggered in your body. If you thought, perhaps out of your own ignorance, that the symptoms of diabetes would manifest a matter of weeks after whatever triggered the disease, it is called latent period of diseases. Diabetes is preceded by an incubation period that can be as short as months or as long as over a decade, depending upon mainly the stress a patient has to go through. One of main reason of diabetes is stress. Here pranayama work marvelously. First let us try to understand how stress is released. When a person sleeps, his mind rests up to nearly 6% and even 45 or 5% in cases of politicians, bureaucrats and big businessmen. But during yoga, if we perform Shavasana for 12-15 minutes, it rests up to 12%, and during pranayama it rests up to nearly 25% to 30%. Here yoga begins to show result, and especially in pre-diabetic patient. And physical yoga squeezes the pancreas, forcing it secrete insulin. How diabetic patient cured? During yoga we see person are recovering from diabetes. To get clinical check we ask the patient to have HbA1c test of sugar, which is a test which show mean sugar level of 3 months. Daily sugar level of patient varies from day to day, depending upon the food or fasting one undergo. Even person suffering from paralysis with sugar, high blood pressure, heart diseases and many other diseases along with sugar are recovering. Following is the series of yoga and pranayama which work on diabetic patient. You can watch more content on health related issues and also talk to the doctors and consult the doctor online on your phone only on Simpler Health. Mirror is the first Indian AI-driven Indian health app that interacts with the user in real time to diagnose the symptoms. Video content library, health content and online consultation is also available on the app. To download the app, clicking on the link below. Health Mirror Simpler Play Store. Health Mirror Simpler App Store. Hindi version of Simpler, available now. For more content like this, follow our page Health Mirror. Answer by Michael Soso. Why there is no permanent cure for type 2 diabetes in this highly advanced medical progressed world? This question is quite reasonable. No rational person would choose the medical care of 100 years ago instead of today's care, except anti-vaxxers. But I repeat myself. Many of us have escaped certain death several times because of seemingly trivial medical procedures or drugs and gave little thought to the tetanus or polio or flu we didn't get or the abscess treated without complication, etc. But advanced compared to what? Our marvelous electronics gadgets, space thingies, metropolises and medicines are simple sticks and stones toys next to the complexities of biology. Humans have productively been using the scientific method to advance medicine for only a few hundred years. Evolution and natural selection have been crafting complexity into living organisms for 3.5 billion years. Modern medicine has many marvels, but, in essence, many of the low-hanging fruits have been plucked. Remaining problems are complex beyond imagining. They resist solution despite concerted efforts by hundreds of thousands of individuals. The question asked by the app would only occur to someone who has yet to study biology, physiology, biochemistry and medical science, and has yet to take the practical labs attached to these courses. Biological and medical research is difficult. Despite the difficulty, research has yielded numerous medicines for diabetes, a complete list of diabetes medications. Review of these medicines and their mechanisms of action should convince the app that the lack of a cure is not for want of trying. Answer by David Ravensborg. There is, in some cases and to a limited extent. First of all, you need to identify what you're talking about when you refer to type 2 diabetes. It's identified by consistently elevated glucose levels and an inability to keep up with insulin production from the pancreas to control those elevated levels. This is usually due to insulin resistance in other tissues in the body. So long as the pancreas doesn't suffer too much damage, type 2 diabetes can be reversed by reducing insulin resistance. However, the extent to which this is effective depends upon genetics, physical activity, nutrition, and many other potential medical interventions which didn't exist 100 years ago. Also, unfortunately, some drug treatments increase the risk of pancreas damage, reducing the person's ability to produce insulin. One issue which tends to be very common in diabetes is increased visceral adiposity. In layman's terms, it means you have a lot of fat deep in the abdominal cavity. This appears to lead to a number of metabolic issues, including diabetes, hypertension, and dyslipidemia. There are a couple main theories as to why this is that I won't get into here, but I can explain in the comments if you're interested. Decreasing this fat can have an enormously positive impact on these conditions. However, the relative distribution of fat is largely controlled by genetics, and it's not always easy to burn away this fat through exercise or diet without significant weight loss, especially when the person is prone to storing it there. So in most cases, people end up simply managing their diabetes rather than removing the underlying causes, factors leading to insulin resistance, because those changes are so difficult to make, and the people who get diabetes are more often the ones who are already more genetically predisposed to developing it. However, diet and exercise can go a very long way towards reversing or at least managing the effects of diabetes and helping people to lead healthy lives.